Good morning, everyone. This is Dr. Bertolino at Smooth Solutions Medical Aesthetics. As you know, I like to call myself the head doc, whether we're fixing the head up here or the female head down there and the male head down there. So today I'd like to talk about something that men have been coming in and asking about for a long time, and it's been on everybody's radar because we've been dealing with drugs like Viagra and Cialis for all these years. A lot of these drugs have sort of lost their spark because of no spontaneity. You have to take the medicine at a certain time. And because they're all generic now, the potency is not that great. So what do men do? They look for other modalities. Remember, erectile dysfunction, guys, is part of life. It's like gray hair. You can color your hair, but it's still gray. Same with ED. So what I've tried to do all these years is bring out for men and women to have better quality of life, procedures that I found that can aid them to be spontaneous, maintain their sexual potency over the course of their relationship. So there are a number of modalities. So we'll go through it again with a little simple anatomy. This is a cross section of the penile shaft. Okay? It's very easy. 3 major chambers, guys. Corpus cavernosa, the 2 big chambers that run alongside the penile shaft. The corpus spongiosum that runs underneath the penis and is fed blood flow-wise by the helmet of the glans penis, which is the head of the penis. So these areas become fibrotic as we get older. They're not so spongy anymore. And then if you add diabetes and you add smoking and you add all these things that form plaque along with natural aging, you're not going to get sufficient blood flow to make the difference in the erection. What can we do about it these days? Well, you can take the meds. That's a good way to start. But other modalities are out there. A simple one. Dysport. You know, the stuff we use for the wrinkles up here? Look it up. Botox or Dysport can be used in the penile shaft with a simple injection on both sides to relax the smooth muscle. What does that do? It allows more blood flow into the penile shaft. It's been proven. This is not me. What else? It also relaxes the extensor tendon, and it has been shown in the flaccid state that certain men can acquire a little more length. That's not really why I'm trying to talk about this. This is about letting more blood get into the penile shaft. Simple, effective, and out there. Look it up. Be a little bit more technical for men and women. We do PRP shots. They've been around for a long time. You've heard of these. The priapus shot or the P shot for men. The O shot for women. PRP is an important thing in your blood, platelet-rich plasma. Again, every consult that comes in, I tell them, it's not based on the injector for the quality of the PRP, whether you're doing your hair, your face, or your sex organs. It's based on the centrifuge. Pure Spin PRP is a machine. It is a quality centrifuge. This makes the difference. And to take it a little step further, the spins we do, based on the cells we collect, can be used specifically for different things. So different spin, orthopedics, joint injection. Different spin, sexual wellness. Different spin, aesthetics, skin, hair. So it is the centrifuge. This is the main point I want to bring out. And then it's knowing the anatomy and being able to place your PRP, and we can also add age 0 exosomes to this mix, which are cell signalers, and placing it logistically to try to help build blood flow. In the male, in the 3 chambers we talked about. In the female, sounds a little rough, but we do it in the head of the clitoris after we numb it. And remember, the clitoris has the most nerves in the human body. We're trying to regenerate that. And we also put 2 small shots in a place called the anterior vaginal wall. That's an O shot. Doesn't take very long. Now, if these things are not effective because a man is far gone, smoked for 40 years, bad diabetes, has coronary artery disease, has plaque, the only other modality that could work, and I'm going to come over here, is acoustic wave therapy. So we use Stort's Medical Deactor 100, which was used in the original clinical trials. This is FDA approved at this point in time. This is shockwave therapy. So it's a little over the top. You have to have 6 to 8 treatments over 3 to 4 weeks. That's the protocol. So how does it work? Well, the shock wave causes what's called a micro trauma to the penile shaft. It's not a trauma you can see. That trauma causes what? Regeneration, right? Just like cutting yourself or anything else we do. We burn your face with a laser, and what happens? Your skin regenerates because you get platelets, stem cells, exosomes going to the part of trauma and rebuilding a blood supply. That's the mechanism of how this type of treatment works. Also remember, we can use this for men who have Peyronie's disease, which is a calcification in the penis that causes the penis to sway or to hook. This is also used for that. So, getting back over here, we want to do this legitimately where we are showing you why these things work, how they work, and that there is a science to this. It's not a joke. So, if you're having problems, and most men will, most women will have problems as they age with orgasms and things like that. Look to us. We have the modalities to make things work. We have the right kind of machines to get the right kind of cells. Think about us. If you have a problem, come in, consultation, we'll show you, we'll bring you around, we'll show you how everything works. Come and see us. Let us try to make your quality of life better. Remember, I'm the head doc at smoothsolutionsmed.com, and our telephone number is 716-633-6100. Give us a ring. Come on by and feel better. Thank you.